Welcome to everyone, all those watching and listening in to the first ever Thinking Bloodless webinar. Before we get started, I'd like to thank all of our partners contributing to the webinar, Carl MacGyver, the creative director for Red Bloodless Medicine and Surgery and the nursing ecosystem, Dr. Nicole Holder-March, founder of MHM Health Consultancy, and last but certainly not least, Josiah Jackson Okasola, lead innovator at Nurses on Air Foundation. Thank you all for hosting this webinar and creating the platform that brings this crucial conversation to the forefront. So I want to welcome everyone on the panel today. We'll all introduce someone different. I have the privilege of introducing, it's my pleasure to welcome another member of the panel, Jill Pryor. Welcome, Jill. Thank you for coming on to Thinking Bloodless today. How are you?
I'm fine, thank you. I'm glad to be here.
Thanks for coming on to share your clinical thoughts here. So we'll just get right into it. Jill, if you could tell us a little bit about yourself and the clinical background that you do have.
Sure, I've been a registered nurse with a bachelor's degree for 27 years. I've worked in the settings of neurology, inpatient care, medical, surgical, public health, including school health.
Well, definitely thank you for all your contribution to working with the public. Thank you for that, and thank you for sharing. Without further ado, we're talking about Thinking Bloodless. So for those listening in, how would you define bloodless medicine?
I would define it as the care of a patient's medical and surgical needs without the use of banked blood products.
Thank you for that. And in your clinical estimation, what effect do you think Thinking Bloodless will have on providers and their practice and even extending to patient outcomes?
You know, I think the healthcare providers that really embrace bloodless medicine are pleasantly surprised with the positive outcomes that they have. And as far as patient outcomes, you know, we know that it's reduced infections and faster recovery. So that is so beneficial.
You know, Jill, as nurses, we are included in the term healthcare providers. You know, it's not limited to MDs or PAs or even nurse practitioners. So how do we, as healthcare providers, engage all healthcare providers to increase their awareness of and use of bloodless medicine in their practice?
You know, I think education is key. We can mentor our colleagues because we know that healthcare providers want the best outcome for their patients. And bloodless medicine is a safe, proven, effective method of treating patients without the use of blood or blood products.
So again, thinking as providers, how do we increase public awareness? We've addressed how we increase providers' awareness. How do we increase public awareness of thinking bloodless medicine?
You know, alternatives to blood should be presented as options for all patients. Patients really appreciate having choices, we know that. And this would increase awareness, and it also builds on that trust that's already established with the healthcare provider.
And so again, going back to that thinking bloodless, do you imagine that with that increased awareness, it's possible that thinking bloodless will become a global new norm?
Yes, with all the quality alternatives to blood transfusion, it is very hopeful that bloodless medicine will become the new norm.
Thank you so much for coming on today and for sharing your clinical thoughts with us. We really appreciate it.
You're welcome, Nicole.
I have the privilege of introducing Nicolette, and I don't want to pronounce your last name wrong. If you could introduce yourself for us, please.
Nicolette Levier.
Hi, Nicolette. How are you today?
Good, thank you.
Thank you for coming on. And if you could tell us a little bit about yourself.
Sure. So I do home health in palliative and hospice care area. And I do pain management. I'm a pain management specialist. And that's what I'm doing currently. But I've had a diverse background when it comes to nursing.
Thank you. Thank you for sharing that. So the theme, again, as I stated previously, is thinking bloodless. And the purpose of this webinar is to really get the concept of bloodless medicine into public consciousness so that people are armed with as much knowledge as possible so that they can make informed decisions regarding their healthcare. So we'll get started. It goes without saying that COVID-19 has affected medicine and the way that it's administered by healthcare providers across the globe. And I think the fact that we have medical professionals on the panel today from 3 continents, it represents that fact. Now, a very specific area that's been critically affected in medicine is blood transfusion. And so we'll open up a few questions to the panel. In your estimation, how has COVID-19 changed the landscape in medicine regarding blood transfusion?
Well, we know that the pandemic has lasted for more than a year. And so it's caused a shortage of blood that's available for transfusions. And I would think that as far as changing the landscape, that with less blood available, that it would mean that medical providers need to look at different treatment options other than blood transfusions.
Okay, so you mentioned that there's a shortage and there are different reasons that account for that, but whatever the reasons, there's high demand for blood and not enough of it to administer. Is it then fair to say that COVID has made thinking bloodless a global necessity?
Well, I would say from my standpoint that given the current circumstances, that it would be wise for medical professions to start thinking bloodless as an option, at least learn about it. I mean, the technology is there, it's not really new, so it would be wise given the current circumstances.
Now, for those listening in or watching the webinar, we're throwing this term around, bloodless medicine, and anyone on the panel who wants to jump in when we think of things when we hear that term. And so what comes to your mind when you hear or think of bloodless medicine?
Well, simply put, bloodless medicine is medical, surgical care without the use of transfused blood from another individual. I mean, that's probably the simplest definition that I would give to it. It could involve alternatives, but yeah.
So we've defined what it is, defined why this pathway is needed. And over the years, there have been patients who've latched on to bloodless medicine, some be it for religious reasons, matters of conscience, or they are concerned about the risk of bloodborne pathogens. But those individuals are just a niche, and they're certainly not representative of the general public. So we've established that there's even a critical need for awareness of alternatives to blood transfusion. And I imagine it starts where it always has, with providers. So how do we engage healthcare providers to increase their awareness of and use of bloodless medicine in their practice?
Well, I would think that we could use social media platforms or webinars such as this, partnering with insurance companies, telemed. I think even it would be good to maybe incorporate it in their education before they even get out into their practice, maybe partnering with some of the schools so to make it part of their educational curriculum.
And if that goes forward as far as increasing public awareness of thinking bloodless, do we anticipate seeing that becoming a global new norm?
Well, again, it's proven benefits for bloodless medicine. There've been better patient outcomes, decreased length of stay in the hospital, decreasing costs. So with it being a global problem, I would say that, yeah, it seems that it would be something that would be beneficial to make it the new norm.
So I have the privilege of presenting another one of our panel members, Phyllis Schultz. And Phyllis, I'm going to ask you to tell those listening in and watching a little bit about yourself.
Okay, well, I started with being an LPN and worked in hospital med-surg back in Minnesota. And then I went on and I got my RN at age 50 and then started working at a hospital again in Ridley Park, PA. And the last 15 years of my nursing, I worked with children on ventilators in their homes. I cared for them in their homes and retired 7 years ago.
Well, thank you for all the work that you've done for the public, and certainly lots of rich clinical experience that you have to draw from this topic. So I'm throwing this question out to the panel again. You know, COVID has really presented challenges across the board when it comes to medicine, and an area that's been specifically affected is blood transfusion. So now we've heard the term bloodless medicine thrown around quite a bit. For those listening in who are interested in knowing what exactly that means, when people refer to bloodless medicine, what is that really?
Well, it refers to medical or surgical care that does not use blood transfusions especially during surgery.
And so when we talk about thinking bloodless, is that a pathway that is normally presented to the public as an option when it comes to medical procedures or things that they're facing in hospital?
I think that more than just Jehovah's Witnesses are concerned about blood transfusion. So I think the public does have that option. I'm sure that if they have any kind of issue or a medical problem, I think that their surgeons would offer that to them.
And you mentioned something really interesting there, Phyllis, that bloodless isn't just for matters of religion. And there have been patients that have latched onto bloodless medicine for religious reasons, for matters of conscience. Some are concerned about the risk of bloodborne pathogens, but those individuals really represent just a small portion of the general public. So there's a critical need for awareness of alternatives to blood transfusion because it isn't something that is in the public consciousness. So how do we engage healthcare providers to increase their awareness of and use of bloodless medicine in their practice?
We have committees go out to doctors and hospitals to educate them on what other things they can use that will help them in their surgeries that will not require blood.
And when it comes to thinking bloodless, do you imagine that's something that will become a global new norm?
I think part of that is already happening because so many people are afraid. It didn't used to be that the public was educated in the diseases and the adverse effects of having a blood transfusion, where today more people are educated about it just in general. And of course, with the internet, they can go on and check whatever it is they are concerned about. And so I think just being more educated has been a good thing for them, and then they have more options.
Okay. I am very pleased to introduce another member of the panel here on the Thinking Bloodless webinar, and that is Dr. Rosina Malaska. Thank you very much for joining us, Z.
I'm so excited to be here. Thank you for having me.
If you could please tell everyone listening in on the webinar or watching a little bit about yourself.
Oh my goodness, where do I start? I've been a nurse for over 35 years now, trained in Oxford, England, moved back to Canada, worked in Vancouver, Canada, and then 25 years ago, moved to the USA. In the USA, I've worn many, many hats. It's just too numerous to mention. But my love for nursing has kept me in nursing, and it doesn't matter what role I'm in or what hat I've worn. I just get so inspired, to continue. My love for nursing is at the bedside. So even though I am a professor, critical care educator, published, peer-reviewed, published author, I speak at conferences around the world. I've even put on my own conference last year, September, which was highly successful. I am back at the bedside doing travel nursing. And in doing so, next month will be 2 years since I've been doing it. I've met some wonderful, wonderful people along the way. And patients have been incredible. I was exposed to COVID-19 working in a 30-bed acute care unit in Houston, Texas for 6 months. And so I've experienced the really, really horrible parts of COVID. I'm so glad now that I've had that experience because it's really helped me to grow and to do more and to know what we need to do moving forward in making care safe for patients. I continue to work on my platforms such as advocating for change in nursing, a healthy therapeutic work environment, communication, patient safety, for better outcomes, and a bunch of other things that I'm doing behind the scenes. But travel nursing is where I'm at right now, and I go from one state to another, and it's kind of exciting,
Well, we're certainly happy to have you on, and thank you so much for sharing your rich level of knowledge and expertise. I'm grateful to have you on the panel today. So we're gonna dig into it, and Professor Dr. Malaska mentioned something really important that we've all had to contend with in one way or another, and that's COVID-19. And I'm throwing this out to the members of the panel. In your opinion, how has COVID-19 changed the landscape in medicine with regard to blood transfusion?
Well, one of the things that we've seen is that there's a shortage of blood. And that is not because there's a shortage of people to give blood. It's because of the restrictions that go with COVID. It's basically people are in lockdown. They don't want to go out. They may be afraid that if they go to give blood, that in some way they may get COVID. There's a lot of misinformation out there. So, that's where the availability of blood becomes an issue. Now, we still have our patients who may be anemic, who may be GI bleeding, and all the other rest of the stuff. In terms of COVID patients needing blood, typically COVID does not deplete your blood. What it does do is it makes your blood thicker, and it makes you highly prone to clots. And these clots can be in any part of your body because COVID-19 thickens your blood, right? So that also in itself will reduce, I guess, the population who may be willing to give blood, right? Because, you got this effect of COVID there. So yeah, so that's what we were seeing and probably will continue to see.
And so you mentioned some of the factors that have contributed to the blood shortage. So those factors and various other factors, I'm sure, have contributed to that shortage. So there's a high demand for something, that being blood, that providers do not have. So then this concept of thinking bloodless, would any of you on the panel want to comment on whether or not that's a global necessity at this point, thinking of an alternative pathway?
I would say, I'm going to jump in here, and I would say that anything that is an alternative to blood is a very good solution. Because what do you do when you have patients that are bleeding out? Just recently, you know, in my last contract, I've had patients come in and they have bled out so much to the point where their hemoglobin and hematocrit, their hemoglobin is a 4, and they come in and they have bled out pints and pints and pints of blood, you know, until they can get the intervention needed to stop the bleeding. So when you've got a patient who's laying in the critical care unit and they have had probably, you know, lower GI bleed, maybe 20 bowel movements. Can you imagine in a 24-hour period? I literally had one patient like that. Just imagine how much blood that patient needs, right? So if you have an alternative that works just as well, number one, it's right there. Number two, the side effects or even the effects of having multiple transfusions will be diminished, right? Because we all know there are some effects to that. Number three, I am sure that on a cost factor side, it's cost effective, right? So when you think about those things, why not? You know, you've got an alternative. Let's explore it. This is innovation at its best, right? So to me, that's a great idea.
And so we talk about patient outcomes. How would, what effect would thinking bloodless have on patient outcomes? What do you anticipate that looking like?
Well, first of all, their stay in the ICU or in the acute sector would be short, right? Because you could get that. You're not limiting what transfusions they're getting, right? Maybe there's not enough blood for them. Maybe the doctor doesn't want to transfuse them if their H&H is 7.5, right? Now they're still going to have reduced volume of blood in their body. That's going to affect the blood pressure. That's going to affect the heart rate. That's going to affect their overall, you know, medical, mental, emotional, physical abilities, right? So if you have the bloodless there, you can, you know, get that right away. But the other side to that is you need to have quick intervention as well. We need to stop the bleeding, but then we also need to get this alternative on board so that we can get the patients out of the ICU and back to normal, right? Because there is no need for a patient to sit in the ICU because their H&H is only 7.5 and whatever the hematocrit would be, usually it's about 24, 24.5. But then their blood pressure is still low and their heart rate is high and they are exhausted. Then they've got respiratory issues, right? Because they don't have that heme to have the oxygen carrying capacity in their system. So just think about it. It's multi, what is the word I'm using? It's basically got very many positives to it, you know. So patient outcomes would be quicker, would be better. Patient can get back home and not be in the hospital. It's a win-win situation.
So when we talk about bloodless, typically people might think of someone who is opting to not use blood for religious reasons, or their conscience, or they're afraid of a risk of bloodborne pathogens. And there's that certain set of the population, but the larger set of the population really is not really aware that bloodless is even a pathway that they can take. And increasing awareness of this pathway really has always fallen on providers. We say providers, we're not restricting that to doctors. We're talking PAs, nurses, nurse practitioners. So what can providers do? Or how can we engage providers so that they increase their awareness of this pathway?
Well, first of all, whenever we have something new that we want to present to the medical community, because they have to have a buy-in, right? So if we can get their buy-in, and to get that buy-in, it's basically education. You know, it's education and marketing and education. Look, this is what it is. These are the side effects, if there's any. I haven't really looked thoroughly into bloodless. However, and here's a cost savings side of it, right? So educate them, show them, do a business plan and show them, you compare blood transfusions, real blood, to bloodless, right? When you can show physicians who really, they rule the roost, if you can convince physicians to try something and you have solid data to show and they're on board, that's it right there. Then all they have to do is go to whatever hospital they're working for or with and basically say, look, here's an alternative. The risks to the patients are diminished significantly, because then we don't have those bloodborne diseases that patients may be worried about. Patient outcomes have increased. It has the possibility to increase it in the sense that you treat the patient quicker, you get them out quicker, right? You stabilize them quicker. And for the population that, for whatever, it may be religious reasons, it may be the fear factor, here you have something right away. You don't have to sit there and think and wonder. Immediately, you are giving them that alternative and they don't even have to stress about it. You're also not putting them at risk of having poor health or being in the ICU longer or in the med-surg floor or whatever. They will not have a blood transfusion. You see what I mean? So you've got that alternative right there. So it's a matter of putting this forward, showing the benefits, showing what can happen, do a marketing kind of advertising, or even, one-to-one knock on physicians' door and say, hey, here's the risks, here's the benefits. You compare them side to side. Why not? Nobody's saying no to blood transfusion. We're just basically getting you to think outside the box and think of an alternative, right? I mean, we're always going to need real blood. We always will. But here's another alternative. Instead of being, limited to maybe HESPAN, and HESPAN is, an alternative, but HESPAN can only go so far, right? And usually when we have patients with religious beliefs that get in the way and they refuse to take it, or any other, demographics of patients, basically we give them HESPAN, right? But HESPAN can only go so far. So the other thing I would encourage would be to, do a business proposition and then try to start teaching physicians or saying, here's a PowerPoint. Would you like to look at this? And then have all of your facts in there and have your comparisons.
So we've heard from several of you as far as how we can engage providers. How do we increase public awareness of thinking bloodless? How do we do that?
Well, it's like what every pharmaceutical company will do. You get the advertising out there. You start with the consciousness, right? So education, education, education. You educate the public. Maybe a doctor doesn't want to do it, but the public comes in and they're like, hey, we saw something on TV, just like they do when they come in and, you're trying to give them one type of medication. They're like, hey, we saw this on TV, and we would like to try this, right? So advertising, again, education with the advertising. It would be, whatever media you use to advertise. You start small and then you go big, right?
And so thinking bloodless, do we anticipate that this will become a new global norm?
I hope so. It's like everything else. I mean, look at COVID. Look at how quickly we had to learn about COVID-19, right? So when we've got patients who, the population of those who could be blood donors has decreased significantly because of COVID, here's our opportunity to think outside the box and engage in something that would provide the same benefits as if you were getting blood.
Well, we certainly want to thank everyone who contributed to the panel today, a wealth of expertise on this very, very important topic of thinking bloodless. Thank you all for your participation.
I had a great time doing it. And I thank you for involving me in this. This is exciting. You know, anything new that's for the benefit of the patient, that would decrease length of stay, that would improve outcomes. I'm big on that. That is all part of my platform for the many other things that I do behind the scenes. So I thank you for involving me and for asking me to on your show here. And I think it was great being with the other members of the panel too. Thank you.
Thank you very much. Have another esteemed guest on our panel today. It's Dr. Carmen Randria, coming to us from Madagascar. I want to welcome her to the panel. Carmen, can you tell us a little bit about yourself and some of the medical experiences that you've had working with blood transfusion?
At the beginning of my career, I worked at the hospital in a service of internal medicine and cardiology. And the head of the service, French doctor, who came from a country in Africa where there were many AIDS patients. He wanted us to remember his blood is the enemy. Prescribe transfusion easily, like the others, because we thought about the AIDS. When we think of blood, we should think about AIDS. When I became a doctor, we organized a meeting at the National Council of Doctors and the committee helping Jehovah's Witness with bloodless medicine. And many doctors and surgeons don't understand that bloodless surgery or medicine could be possible. There were 2 women in the service, and one was Jehovah's Witness, and the Jehovah's Witness didn't get transfusion, but the other got transfusion. The day after, when I came to the hospital to see them, the Jehovah's Witness woman was alive and the other woman was dead. So I understood at that time that blood transfusion doesn't mean life. And I always tell this story to my colleagues when they say that they think that blood transfusion gives life. It is not necessary that.
So Dr. Randria, you've worked through the AIDS epidemic and you've seen lots of things in your personal practice regarding blood transfusions and the things that can come about from that. Can you speak a little bit to some of the benefits of bloodless medicine, how that's something that can help patients?
The patient doesn't need to get blood transfusion. The body can support a long period without getting a blood transfusion, because the anemia was installed progressively. Is many diseases, not only AIDS, hepatitis, even malaria. There are many risks with blood transfusion.
You mentioned some of the benefits of bloodless medicine. How do we get more doctors thinking about it?
When I speak with colleagues, I always explain them that it is difficult to get blood in Madagascar. It is very difficult to get blood. It is better to think alternative, but there are alternatives to blood transfusion. they should learn about the alternatives and not always insist in thinking to blood for the treatment.
And in Madagascar, you mentioned that there's a shortage of blood. Why has
Yes.
that been happening? What has contributed to the shortage?
There is no blood who is available to the patient. The family should search for the blood, and they don't find the same group. For example, it is difficult many times. So when we talk between us, they see that I'm right. Someone who can show what can be done without blood transfusion.
So really get it out there so people are thinking about it and that they know about it.
Yes, yes.
Well, Dr. Randria, thank you so much for coming and being a part of the panel today. We appreciate your wealth of expertise and thank you for sharing your thoughts on thinking bloodless.
Welcome.